Well, you've got the cook, the shopper, the caregiver, the professional, and the mom. Sound familiar? It's all the same person. Between work and family, is there ever time to focus on your own health? Bridget talks to a nurse about tips on handling your very busy life.
I'm very interested in this topic because being a woman in my 30s, I realize how different my medical needs are now than they were in my 20s. What is your advice to women who are saying, how can I just improve my overall health no matter what age I am?
Well, this is a question I get from all of my patients. And you know what? You may be surprised to learn that less than 10% of American women are getting enough calcium every day. So what I would say is if you're not getting 4 servings of dairy every day, consider taking a calcium supplement with vitamin D, because we really want to keep our bones strong and healthy. And if you're in your 30s, now might be the time to consider an omega-3 fish oil capsule, because that helps keep our hearts nice and healthy.
So if we're not getting it from all the foods we need, because oftentimes it's difficult to sit down in the evening and do a well-balanced meal, you are a big proponent of supplements and that kind of thing.
Well, you know what? As a mom and a nurse, I'm all about food first. You know, a healthy, well-balanced diet is really the cornerstone to staying healthy. But, you know, I have to be realistic. I have a 14-year-old son at home. It's hard to get him to eat 5 to 7 servings of fruits and vegetables every day. And it's hard to get those 2 servings of fatty fish every week. So if that's not happening, I do recommend vitamins and supplements. I mean, I take one myself, but I also put one on the counter for him to take before he heads off to middle school.
Right.
In fact, 95% of nurse practitioners also take supplements.
Let's talk about nurse practitioners and why they are so necessary, Barbara.
Well, nurse practitioners, what we do is examine, diagnose, and treat millions of Americans in lots of different settings, hospitals, clinics, even schools. We're all about health and wellness, and that's why I'm delighted to be working with the Life Supplemented campaign, because they're all about health and wellness around the 3 pillars of health, and that is, first, healthy, well-balanced diet, just like you said. Second, vitamins and supplements to fill in those nutritional gaps. And third, exercise.
I was going to say, you know, we don't often get to visit our doctors and our nurses as often as we should. Talk about some of the things we can incorporate into our daily lifestyles. You touched on exercise. How much exercise should we be getting a day?
Well, what we know about women is that if you want to maintain your weight, just do 20 to 30 minutes every day. You know, a lot of women think, well, I should be losing weight at 20 to 30 minutes a day. But the key is go up to an hour a day if you're trying to lose weight.
For women in their 30s, how do you increase energy naturally without, you know, obviously, you know, doing things to enhance your metabolism artificially? How do we increase metabolism and energy?
It's a great question. How do we increase our energy? Well, one of the things you can do is try to get enough sleep. And you know what? It's not just one thing. It's got to be a well-rounded wellness program. What I encourage people to do is go to lifesupplemented.org. Take the My Wellness scorecard. They're going to ask you all sorts of questions about your diet, your sleep, whether you smoke, how much you're drinking. And what it does is prints out some simple steps you can do to have a more well-rounded wellness regimen. You can also take that to your nurse practitioner or other healthcare provider so that they know where you're starting from so they can make suggestions about where to go. But number one is try to get more sleep.
Barbara, you've been helping people, you know, stay well and get on the road to being healthy. What is the biggest thing that you've learned? What is your secret to staying well and staying energetic? What's worked for you, just as a nurse practitioner who's seen and knows it all?
Well, I'll tell you what. As simple as this sounds, and I know, Bridget, you've heard it a million times before, but that's because it's true. The key is for women is that they've got to make time and focus on themselves and their wellness. So it's not just one thing. Focus on yourself. Give yourself permission to take care of yourself.
Right, because if you're healthy, you can do anything.
That's true.
Barbara, thank you so much for joining us from New York City this morning, and have a great day.
And coming up, a free local event for your friends and family and your gardening tip from Skip Richter when we come back.